There's a philosopher called Timothy Morton, and he talks about ecological thinking. And I think really realistically, I would like people to think about their communities as the whole ecosystem and the human and other than human beings that inhabit that ecosystem. But maybe people should just start with the humans that inhabit their ecosystem. And like I said, I think we need to start exercising that communal muscle. We need to start reaching out and connecting to the people in our communities. And we need to start thinking about our actions in terms of how they affect the people that surround us. Mutual aid is the idea that I might need something from you today, but it's not charity that you're giving me because tomorrow you might need something from me.
That's Dr. Wendy Johnson, who has a fabulous new book called Kinship Medicine. It's a little bit of a departure from regenerative agriculture, but I think as you listen, you will hear the parallels. We're going to be talking to her on today's program. You're listening to Down to Earth, the Planet to Plate podcast, a co-production of Radio Cafe and Quivira Coalition. I'm your host, Mary Charlotte Domandi. We'll be back right after this announcement. This year's Regenerate conference schedule is shaping up to be full and insightful. From November 5th through 7th, we will be bringing together so many great speakers, roundtables, and workshops on strategic business planning, do-it-yourself soil health evaluation, bonding and training livestock guardian dogs, and so much more. Registration will open the second week of July, so keep your eyes open on the Regenerate website or newsletter for the announcement. regenerateconference.com. And now to our program. It's a great pleasure to welcome Dr. Wendy Johnson. She's a medical doctor and public health expert. She's author of the new book, Kinship Medicine, Cultivating Interdependence to Heal the Earth and Ourselves. She lives here in Santa Fe, New Mexico, where she spent years practicing family medicine as director of a community clinic. Welcome to Down to Earth.
Thank you so much, Mary Charlotte. It's great to be here.
It's great to have you. You used to come on my old show, the Radio Cafe, when we did that show here in Santa Fe for years and years. And when you published this new book, Kinship Medicine, I thought, well, it's not exactly regenerative agriculture, but it's this like the same mind space as regenerative agriculture.
It is. I think the idea about regenerative agriculture is connecting more deeply with the land and kind of listening to the land and being in community with the land and the other creatures that we share the earth with. And that's what the book's about.
Yeah. And it's so, okay, this is sort of what I derive from it. You can tell me if this is right or wrong, but basically it's about looking at medicine from an ecosystem perspective. So not only an individual going to the doctor and having doctor visits and checkups and getting blood tests, which I do religiously, and some people do, some people don't, whatever. But instead of just that, it's the whole context of that person's life and their surroundings.
Right. What you will see in the literature and what I have learned over the course of my 30-year career practicing medicine, working in public health, is that about 80% of our health is really determined by those environmental factors. Where we live, our relationships, our connection with our communities and our environment. And only about 20% is the genetics and biology that's most of what our doctors focus on. It's most of what I learned when I was in medical school, that 20%. Some of the 80% I learned in public health school, but even then, there's not really a space in the healthcare system to work on that 80% in any kind of real way. And it's been super frustrating for me as a family medicine doctor, especially the farther along I get in my career, the more I really talk to patients and listen to patients, to not really have tools, to not really have a healthcare system that's set up to address that 80%. And that's what this book is really about.
So what actually constitutes that 80%?
Well, I do tell some stories in my book about patients. I tell a story about a patient, names have been changed of these patients, that came in to see me after really never having seen a doctor in his life and really tried to ignore mounting symptoms of gaining weight, headaches, fatigue, until he couldn't really ignore it anymore. And when he came in, he had very high blood pressure, very uncontrolled diabetes. He was quite overweight and he was smoking. He had a high stress, low paying job. And, it was very hard to control all those things. But when we worked on them together, we were able to get his blood pressure down, his diabetes controlled. He quit smoking. But then some horrible things happened in his life. He had some issues with his daughters becoming addicted to heroin at that time. His wife left him. He had a really low paying job at a fast food restaurant where he couldn't really get health care, didn't have health insurance. So all of that combination of things, which came from his social environment, right, really knocked him on his heels. And he went back to having really difficult time controlling those other health issues. I see people all the time in northern New Mexico. I've seen a lot of people who worked at Los Alamos and have a lot of environmental exposures from their jobs at Los Alamos and suffer from cancers and other kinds of lung diseases because of their environmental exposures on their job. I see a lot of people with addiction in northern New Mexico, and a lot of those folks have experienced significant trauma in their relationships growing up. We have every year now, I worked in Las Vegas for a while and saw a lot of people around the time of the Hermit's Peak Calf Canyon fire.
We're talking about Las Vegas, New Mexico, ladies and gentlemen.
Exactly. Las Vegas, New Mexico, a few years back, we had the biggest fire in the history of the state, burned a lot of people's homes, and just the mental health effects of having the home that your great-grandfather built and the ranch that has been in your family for generations now completely destroyed. A lot of people couldn't even get to their ancestral homesteads because the roads were all washed out. Now they're having huge water problems in Las Vegas as a direct result of some of the aftermath of these fires. So the reverberation of some of these environmental, it comes from community, it comes from the ecosystem, it comes from climate change. All of those environmental factors impact how easy it is for us to be healthy or not healthy.
And those are things that you as a doctor can point out, but you don't have control over them and the patient doesn't have control over them.
Yeah, it's another big example that I give, and the healthcare system doesn't care about them really.
Right.
One big example I give of that is depression. So we have quality of care measures in healthcare that we're supposed to be following, and one of them is screening people for depression. So there's a screening tool you use, basically asking people, do they feel depressed? Do they feel down? Do they have problems sleeping? Do they feel unmotivated? Do they have thoughts of self-harm? Those kinds of questions. At no point in this questionnaire is a question about why they might feel that way. So you can ask all these questions. You can score a person and give them a diagnosis. Oh, you have severe depression. And you can put them on a medicine and you will get high marks from the value-based care people and the quality care people because you checked all the boxes and you did it right. But you have no idea what this patient is really experiencing. And unless you ask them, why do you think you feel this way? I had a patient that I was seeing them 2 days after they found their teenage daughter, dead of a drug overdose. So, of course that person's going to be depressed. Me prescribing an antidepressant to that person isn't really treating the problem. And so much of what we measure in medicine about whether or not we're doing a good job of taking care of our patients, because it's things that are easy to measure, are about ticking off those boxes. Did we get this blood test? Did we screen for this problem? And not really asking those more difficult to quantify, qualitative, subjective things to learn about our patients' lives.
And it's so, again, I'm thinking about agriculture and the industrialization of agriculture and the industrialization of medicine, where, you get to see patients, if you're in some kind of corporatized system, which more and more of medicine is, you get to see patients for 5 minutes or 7 minutes or
Right.
8 minutes or 10 or something like that. And you can't, even with the best of intentions, you can't draw a person out in that limited space of time.
Right. And in that limited space of time, you're being graded as a doctor on whether or not you're checking all these boxes, right? And there's no boxes to check for asking somebody about, what do you do? Who's your family? What's your living situation like? All of those questions, which I think are way more important to someone's health than most of these boxes we're checking off.
One of the things that's so interesting in the book that you talk about is this kind of like individual centered perspective and this industrial perspective that we're in now, and that we're kind of like in some extreme, almost like grotesque caricature of right now, comes from a mechanistic view of people in which we are seen as machines whose functioning is basically the sum total of our organs and blood and bones and things like that. People didn't always think about health in this way. I mean, this is a sort of Enlightenment perspective, and it's not to say the Enlightenment was a bad thing, because so much of what we appreciate in our lives right now comes from that kind of thinking. But like, what is that mechanistic perspective? What is Enlightenment thinking?
Yeah, I mean, I think that there's a lot of examples that you can take that are true probably for agriculture and for medicine about how we kind of view things holistically in one philosophy. A lot of indigenous philosophies, both for agriculture and medicine, kind of view the world holistically as an ecosystem and look more at balance. There are also medical traditions that did that and still do that, traditional ways of healing and that kind of thing.
Herbal medicine, acupuncture medicine.
Well, yeah. I mean, Chinese medicine, Ayurvedic medicine tends to look more at this whole ecosystem perspective and balancing different aspects. And the problem is a lot of even quote unquote alternative medicine, when it gets translated into our Western ways of thinking, gets mechanistic, So I think it's not just because it's quote unquote alternative medicine that necessarily gets at this. But I think that when you ask the question, what is that Enlightenment thinking? Where did we go wrong? There were a lot of thinkers. Aristotle, Descartes is the one who really decided that people are different, human beings are different from animals because animals don't have a mind. So he decided the mind and the body were completely different, completely separated. And that perspective of separating out the mind and the body and the soul, which he decided only humans have souls and animals don't, but separating out the mind and the higher thinking that supposedly only humans were able to do versus your body that really just operated as a machine, and animals also just operated as machines. They didn't have emotions. They didn't have higher thoughts. They didn't have free will. They were just completely driven by instinct.
Descartes didn't have a dog.
Yeah, clearly. Didn't have a dog, never saw an animal, really. So he decided that philosophy kind of gave us modern medicine, which separates us out. We have our biological functions of our body, which is the job of, medical doctors like myself. That's what we get trained on. Then we have behavioral health that does the mind, right? And those two disciplines are completely separated in most places,
And yet we have, so much of quote unquote behavioral health now, or mental health, is rooted in the perspective that you should give people pills, which is based on a sort of biochemical view of the mind.
Right, totally. And that is, spilling over to this mechanistic view even of behavioral health.
Exactly.
Yeah. But I think that having these things completely divorced, the mechanistic, view of the body and the mind really, and then this higher function of the mind that only humans have, was really problematic to the way that we see healing, to the way that we see how healing happens and how illness happens, and the connection between mind and body. The other thing that was really detrimental, I think, is thinking of us as individuals. And even 30 years ago when I was in medical school, we learned almost nothing about the microbiome. And so we're not really individuals. We are really ecosystems. We're really walking, talking ecosystems. And if you were an individual, if you didn't have your microbiome, you couldn't survive. You couldn't survive without all the little microbes that help you digest food, that help your skin stay healthy. So we're not really just talking about our own biological functions, but we're talking about all the biological functions of all the organisms that make up our being. And that's something that medicine really hasn't. We know a little bit about the microbiome, but very, very little, really.
Another thing that was detrimental about that way of thinking is that it elevated certain people, virtually all of them men, into positions of power in medicine, and every other kind of healer was basically not allowed to practice medicine anymore.
Yeah, this might be my second book. I don't really talk about that so much in the book, but in Europe, there were the witch trials. In the United States, there was a thing called the Flexner Report, which is in the early part of the 20th century, an effort to kind of professionalize medicine. And what that meant was these universities like Johns Hopkins and Harvard decided these were the keepers of what was really medicine. And if you didn't have a degree from one of these places, and basically only white men did have a degree in one of these places, then you couldn't practice medicine. You weren't really a doctor. So that meant midwives, that meant any kind of traditional healers, that meant folk healers, that meant indigenous people that had their own science and technology. I think it's very important to call what indigenous people were learning and doing, because it was based on, centuries of their empirical process, and we have to call that science. It just dismissed all of that. So anybody who was not practicing what I have learned is allopathic medicine that was deemed to be, the only true way, couldn't really practice medicine. It became illegal to quote unquote practice medicine without a license. You had to have a license. You had to have a degree from one of these places. And so women healers, traditional healers, indigenous healers, they were kind of outlawed.
The alternative metaphor, which it really is a new paradigm. And again, I don't want to push this too hard, but, we're seeing these alternative paradigms, or, the new paradigm, which is really the old paradigm in agriculture. We're seeing it in medicine. We're probably seeing it in all kinds of other places in our society right now as we shift necessarily to a holistic way of thinking, because the mechanistic way of thinking is bringing us, pollution, climate change, and all kinds of problems that we cannot overcome with the same tools for problem solving. The metaphor that you suggest for human health is the metaphor of the garden.
Yeah.
And I like that because a garden is different from, a big ecosystem. It's different from a forest. It's like this thing that you, as an individual or as a family or as a neighborhood or whatever, cultivate.
Right. Right. When you have a garden, I'm a big gardener. I really like messing around in my yard. And I'm on an acequia system, which I talk a lot about in the book too, because I think that creates a certain kind of community and connection.
By the way, for those who are listening who aren't here in northern New Mexico, acequias are these ditch systems that were brought over by the Spanish but have ancient roots in all kinds of places that people used to basically do a kind of community-based watering system of agriculture.
Right.
And they still exist. They're not the dominant thing anymore here in New Mexico, but they still exist, and you're very much part of it.
Yeah, no, I am in my community, and it feeds my vegetable garden. So, if I am having a garden and I look at my tomatoes and my tomatoes aren't doing very well, I don't think of what medicine does my tomato need. I think of the whole environment. Did I plant this tomato in a place that doesn't have enough sun? Is the weather wrong? Has it not rained? Am I not watering it enough? Am I watering it too much? What's the quality of the soil? And do I need to fortify my soil or something like that? You're looking at the whole environment, and is this environment the right environment for this plant? Am I nurturing an environment that will allow this plant to thrive? And so I think if we have that same view of humans and human health, we need communities that are cohesive. We need families that are strong. We need, other kinds of resources, good food, clean water, clean air. We need all of those things as a bare minimum to thrive. So when I see a patient in my clinic that's not thriving, like we were saying before, modern medicine doesn't have a space for me to even consider those questions. And even if I do consider those questions, there's no space at all for me to act on that. I mean, I act on it as an activist, as a local, very active, community member here, as a member of my acequia, as a person who writes op-eds and goes out and protests and, makes my views heard and votes and all that kind of stuff. But the medical system, as certainly the public health system does a little bit more, but I would say even that, not enough, doesn't really weigh in strongly on, hey, look, we need to address these problems as a whole community, not as individuals. And I think we should take on that responsibility in the medical system much more.
There was an example in your book of a patient who really sounded like she was in pretty rough shape. She didn't always take her medicine. She didn't do what you told her to do, and she had all kinds of health problems. And she just kept surviving. And you attributed that to the fact that she had a really strong family and was like in this happy and supportive environment.
Yeah. I mean, I think her connections to her family were really strong. I mean, many of my patients have really strong relationships with me. I have really strong relationships with them. I actually feel like I kind of fall in love with every one of my patients because I learn about them, and they're just awesome people. If you learn about anybody enough, I think you find awesomeness in them. And I felt that way about her, and she could feel that I felt that way, that I really genuinely cared about her. And, one thing that she refused to ever get a mammogram. And I just didn't even raise it with her because she said, I don't want to know. God's going to do what God wants to do, and I'm not going to mess with it. It's not worth me having an argument with her every time I see her about her mammogram because I know she feels that way. And there's a lot of other things. For example, I think I really helped her. She had diabetes. I think I really helped her take her insulin because we focused on, okay, mammograms, it's going to be just a waste of my breath to have that conversation. But let's try to work on some areas where there's some overlap, where maybe I can help her do some things because she trusts me. And, we talk another thing about placebo effect. When we talk about placebos and, a sugar pill or whatever it might be, the power of the placebo effect is in the relationship surrounding it, the context surrounding it. So if somebody you really trust gives you something, even though you might know it's just a sugar pill, if somebody you really trust says, no, this really is going to help you, you're more likely, and this is borne out by evidence, that it might help you. That's what the placebo effect is. There's some amount of that, again, that mind-body connection that's really important.
I knew a guy who worked as a jailer in a small town in Alaska, and he was very tall and had a very peaceful demeanor about him, and all of the inmates loved him. And they were always complaining about their pains, and so he would give them these pills called Obicalp, which is placebo spelled backwards.
That's really good.
And they would be like, oh man, I need some more of that Obicalp.
Good for everything. That's very good. I like it.
One of the things that you talk about in the book, which is so important, is, there are factors that you've talked about. There's, radiation poisoning, there's pollution, there's heat, there's wildfires. Another piece is inequality has a detrimental effect on human health. Yeah. First of all, what does that look like, and why is it like that? Why, how does inequality harm people's health?
Yeah, this has been really studied and written about by a lot of really smart people over the years. And so when I teach public health courses, one of the things that this Alameda County study, which was done kind of in the 70s and 80s, I think, looked at different neighborhoods and the socioeconomic status of different neighborhoods and found that even adjusting for any kind of health behaviors, smoking, diet, obesity, all of that, that if you lived in a poverty area, that you were even if you were a wealthy person that lived in an area of great poverty, you were more likely, you had I can't remember but almost like a 2 times a higher mortality rate than it. And there's been other studies that have looked at different communities or countries in the world that there's a thing called the Gini coefficient, and it's a measure of inequality. So places that have greater equality, some examples are Costa Rica, Cuba, even Japan, Sri Lanka for a while. There's a place in India called Kerala, a state of India in the southern part of India called Kerala, that have not very much inequality. The richest people don't differ very much from the poorest people, don't have like 50 times or 100 times or thousands of times now more resources than the poorest people. In those places, life expectancy is longer, the rates of chronic disease is much lower. So why is that? Well, living in a very, very unequal society is stressful for everybody. Living in a society where everybody's equal, there's a lot of reasons why it's speculated why this happens. But basically, it's resources, I think, is one of the big ones. When a vast part of the population is denied access to things that we need for health, we're going to be less healthy, and it's going to be more stressful. And we can see this in the United States today. We're one of the most unequal countries in the whole world right now, especially among rich countries. It's very stressful to know that there's people like Elon Musk, or Jeff Bezos, who has any number of yachts, when you can't afford to put food on the table and not to have access to the things that you need to be healthy. But it's also more stressful even for those people at the highest levels of income, because they have to guard all their stuff and they have to live in a society that's very polarized, and very polarized societies tend to be more violent, more dangerous, higher crime rates. We're seeing this in all the political crime that's happening in the United States right now, and other kinds of violence. And so all of that contributes to worse health. I think the stress of living in a very unequal society is one of the major things that contributes to poor health.
There's such an interesting example in the book of a place called Roseto, Pennsylvania.
Yeah.
Italian immigrants named the town in Pennsylvania after their town in Italy called Roseto, Italy, whatever. Mm-hmm. And they had incredibly low rates of heart disease and all kinds of things. What was going on there?
Yeah, it was just they took their communal traditions and their cultural traditions from home. And it was mostly for a while, until about, the 70s and 80s, it was a place where the vast majority of people living there had come from this very small area I think it was in Naples, in Italy, in southern Italy. And so their families had known each other for generations. And they just, even though they had high rates of smoking and drinking, they had almost no heart disease for a couple of decades that they studied this area, until, there was some economic downturn, more people moved in, it got more diluted, and then rates started to equalize around this. But they compared this town to other towns that were similar socioeconomically nearby, and they found that it was just a more cohesive community. And this is one of the effects that economic equality has as well. When you don't have gated communities, or, when you have a lot of inequality, you have people sending their kids to private schools, you have public schools underfunded, there's a lot of ripple effects. But when you have everybody sharing the same resources, and kind of like the acequia, the irrigation system that we have in New Mexico, when we have everybody sharing the same resources and everybody contributing to those resources, like public schools and public roads and parks and things like that, you just have a more cohesive community. Everybody's helping each other out. People know each other. People trust each other. And, people are healthier.
It's very interesting, because one of the things that has been, quote unquote, discovered by science in fairly recent years that was known by probably indigenous people forever and ever, which is that trees talk to each other. Like trees have a communication system.
Right.
And on the last podcast, we talked to a guy from the Boston Food Forest Coalition who was talking about planting trees in vacant lots and having like little mini food forests throughout the city, which they're doing. It's incredible. And one of the things he said was street trees don't live very long. And I was thinking, these street trees, they're by themselves. They don't have anybody to talk to. Right. And I was just like thinking of them as these people who are doing their best to survive, but they don't have a community.
Right. And we can't survive without a community either so well, And I think that we have seen life expectancies both in the UK and in the United States really level off in the last 10 or 15 years. So, of course, we've had the COVID pandemic, we've had other pressures, but the inequality is really underlying all of it. And it's going to be really hard to address it if we don't address that root problem.
Associated with that is just like simply loneliness, which is what happens when we live in this fragmented and disconnected society.
Yeah, and it's a sort of vicious circle because... And it's interesting. I have a housemate right now who came from Florida, from a little town in Florida. And he actually, with his partner, had a little inn there. And they ended up getting devastated by the hurricanes. And so he's kind of a climate refugee. And he's come here and he's kind of trying to rebuild his life. But he's been just very surprised about the sense of community here in Santa Fe, and especially in this little part where I live in Chupadero, because he felt like in Florida, the knee-jerk response that you have to somebody approaching you, to coming over to your house, to talking to you that you don't know, is distrust. Yeah. And so when people get polarized and disconnected, and I think social media does this a lot too, it's so easy to just go into that default distrust mindset. And they have found this about isolated people. The more isolated you are, the more susceptible you are to racist ideas, to violent ideas, to even, they showed that people who are really isolated stand farther away from other people when they're out in public or at an event or something like that. They just are more suspicious of other people. So your mind changes. And I think our communal mind, our mind that we really had through most of our evolution, has really atrophied, has really degraded over the last few decades. And we've forgotten how to be members of community. And
some of us anyway.
Yeah, some of us anyway. You're right. I mean, I think a lot of us have. And it's been really interesting for me with this roommate who recently came to be like, oh, really? This is how you operate things? Wow. If somebody approached me or somebody else in my community in Florida, they never would, share, offer, or welcome somebody in. Their first response would be, oh, what do you want from me? You're trying to put something over on me, or you're trying to take something from me. And I think we see that a lot in even our politics in the country. It's very scary.
So you as a doctor, if you had a prescription for the country and for the world, I mean, it's so big that it's almost overwhelming. It's like, restore more equality or equity, economically, and clean up the world and reverse climate change. I mean, it's huge.
Yeah. Well, there's a philosopher called Timothy Morton, and he talks about ecological thinking. Okay. And I think really realistically, we need to, I would like people to think about their communities as the whole ecosystem and the human and other than human beings that inhabit that ecosystem. But maybe people should just start with the humans that inhabit their ecosystem. And like I said, I think we need to start exercising that communal muscle. We need to start reaching out and connecting to the people in our communities. And we need to start thinking about our actions in terms of how they affect the people that surround us. Because that's what mutual aid is. We saw a lot of great examples of mutual aid during the COVID pandemic. And I think, we need to just keep working on that. Mutual aid is the idea that I might need something from you today, But it's not charity that you're giving me, because tomorrow you might need something from me. And we recognize that we're all connected in that way. So I think all of us can work on being better members of our community. First with the humans, maybe, but maybe first with also our environment. Think about things that you do every day and how they affect the environment at large. Little things and big things. Can you buy more local and help improve your local economy and not give so much of your blood, sweat, and tears to these major industries that are tearing us apart and contributing to greater inequality? Buying local. I try to go to the farmer's market almost every Saturday. I grow a lot of my own stuff. So this time of year, I'm like, oh, I have that home. I have that home. I have that home. But either that or, I try to buy the stuff that I don't have locally or at the co-op or something like that here in Santa Fe. Think about, even little things like killing a spider in your house. I mean, it's not going to change the world, but starting to look at how you can coexist. I mean, I've had raccoons in my roof. It's hard to coexist with raccoons in your roof, but how can I work on getting rid of them without killing them? How can I coexist with the other animals and other things around me, even if it's just a spider in your house or something like that? Start just retraining your mind to think that way. And eventually, I think if we all can really think that way, of how can we live a little bit more lightly and a little bit more interconnectedly on this earth, the little things will build into bigger things.
And the little things, it's not only that they might make a little difference. Like I do this. I take the spiders out. Like I put a cup over them and then put a piece of paper under it, and I take the damn things out. It drives me crazy because I've just gotten so obsessive about it. Mm-hmm. And I don't even, my husband doesn't even take black widows out. This is a conversation.
Yeah, this sounds like a deeper issue.
Yeah, right. But it's not just like what it's doing for your ecosystem. It's what it's doing for your mind. Because when you start, like I don't know when this happened. It's happened sometime in the last 20 years. I've been living in Santa Fe for 35 years. And I just think of everybody as people. Like I think of that apple tree out there that we're looking at as like the apple tree person, and my dogs are the dog people, and then the spiders become the little spider people, and it's harder to just kill them,
right?
And so you have to take them out, and that gets into this whole, and obviously you have to draw the line somewhere. Like I was just on the East Coast and I took a walk and I came home and I had 5 ticks embedded in my body.
Right.
And I do not have any sympathy for them, and I don't think of them, I kind of do, but I don't think of them too much as tick people, because you have to kill them, because otherwise they're going to give you Lyme disease or,
totally.
So you have to draw the line. But still, it changes from that thinking of like the hierarchy with humans on top to humans as part of the ecosystem. And as you say in the book, and this is something I wanted to get into with you, is humans can be thought of as a terrible detriment on the earth, but they can also be thought of as a keystone species.
Right. Right. And I think that one thing we have to do is shift from this anthropocentric and even white supremacist and male-dominated patriarchal way of thinking to a life-centric way of thinking. And, there's a lot of ways historically that humans have really fostered an environment. I would even say the ticks are an example of the opposite of that. There's some really great, I can't remember the author of this book, but there's some great studies about Lyme disease that talk about how ticks have really spread because of altering the ecosystem, of altering, not having predators, having proliferation of deer and even other mice that carry the ticks and things like that. And so, sometimes we don't realize when there's a lot of talk about killing wolves, for example, going back to regenerative agriculture. And what happens when we kill all the predators and what the ripple effects of that are. And it can be something like increasing the tick population down the road. So if we really think about how can we, instead of destroying the environment, how can we provide the conditions that would allow the environment to thrive? There's movements to rewild people's lawns. And again, rewilding one lawn, is that going to change the climate? Is that going to solve climate change? No, it's not. But my thought is that even if tomorrow we found a technology that sucked all the carbon out of the air and made climate change.
We have that. It's called soil.
Yeah, well, that's right. But even if we figured out a tech solution, which a lot of people are, banking on, we're going to find some tech solution. Even if we found the magic tech solution, I maintain that if we keep living in this disordered way, we are going to degrade the soil. We're going to have all kinds of other things. We're going to decrease biodiversity. We're going to have more Lyme disease. We're going to have all kinds of unforeseen other effects because we can't control our growth on this planet, and we can't control our consumptive, individualistic way of living. And until we really act like good community members in these communities of human and other than human living beings, we see them as our neighbors and our friends and our family even. And so we're not wanting to hurt them, and we're wanting to think about, just like you think about your family, oh, what can I do for my mom that would be nice? That's what we're going to think about Mother Earth as well.
So here in Santa Fe and a lot of places like this, you have people who kind of rail against Western medicine. Western medicine is the bad guy. And, I have a problem with that too, because first of all, I don't think I would be alive without Western medicine. I've been saved on a number of occasions, and the quality of my life, it would be terrible without a couple of key surgeries that I've had and antibiotics and stuff like that. So, when you talk about balance and seeing the garden paradigm for human health and the ecosystem model as keeping things in balance, I think one of the other balances we have to have is a balance of, Western medicine and reason and the mechanistic thing, which does have its place.
Yeah.
And this other way of seeing.
Absolutely. 100% agree. I mean, I talked about that 20% and 80%, but that 20% is really important, very important. And it has been, I think, the reason that our life expectancies have gone from, I think, in the 50s, 50-year-old or so in the 1900s and late 1800s up to in the 70s today. So that's all been all these advances of Western medicine. The germ theory was really important. There are germs that are bad. We talked about Lyme disease and the ticks and all of that. There are things that are going to hurt you and kill you. But it's part of the story, just like there are predators that are going to hurt you and kill you. And there's ways that you can coexist with those things, but they depend on, building your immune system. Again, looking at things holistically. So I think we've gotten, I'm not saying as far as we can get, but we have optimized most of those gains. And I think now we have to change the paradigm if we're going to continue to address our health as a species.
And still keep the good stuff.
And still keep the good stuff, of course. That stuff is all super duper important. If you break a leg, the germ theory led to figuring out that we need to wash our hands and we need to have antiseptics and stuff for surgery. And that led to really decreasing the rates of maternal mortality. And, there's the ripple effects of all of that. So all of that stuff, and, this recent attack on vaccines and, what all of Western medicine really, I think, is going also the totally wrong way. So I completely agree with what you're saying.
The book is called Kinship Medicine, Cultivating Interdependence to Heal the Earth and Ourselves. Wendy, you are going to be speaking here in Santa Fe, New Mexico at Tumbleroot, which is a location where all kinds of wonderful things happen. I'm going to hear a concert there tonight. You are speaking on Tuesday, the 15th of July at 6:30, which is sponsored by Collected Works Bookstore. You're also going to be going all over the country.
Yeah, I have Albuquerque on July 17th at Bookworks. And then I'm doing a swing around Ohio in early August. That's I grew up along the shores of Lake Erie, and so I'm going to Cleveland, Columbus, Toledo, and Detroit. I'm going to the Northwest later in August and September to Portland and Seattle, and also DC sometime in the fall, and probably more dates as well. You can find all that on my website, which is wendyjohnsonmd.com. So I have a page which will update all the book tour sites.
Dr. Wendy Johnson, thank you so much for being with us on Down to Earth.
Thank you. It was great to be here.
You've been listening to Down to Earth. We would love it if you would support this program, which you can do by going to patreon.com/down-to-earth planet to plate, where you can sign up for as little as $3. Patreon is Patreon. And also please rate and review the podcast on Apple Podcasts or wherever you get your podcasts. The Quivira Coalition is a not-for-profit and a community network of ranchers, farmers, conservationists, scientists, educators, and many others dedicated to regenerative practices that produce healthy food, support meaningful livelihoods, sustain biodiversity, and remedy the impacts of climate change. To learn more about Quivira and how you can support their work, visit quiviracoalition.org, Quivira. And finally, this show is a production with the Radio Cafe. You can check out radiocafe.org to hear back episodes of this show and also find all kinds of other shows on a wide variety of topics as well. Thanks for listening, and we'll see you next time.